assignment, we choose an ultrasound machine for our modalities. The brand that we choose from GE. GE one of the popular brand, and the model machine is VOLUSON S8. The ultrasound is class 1 device and also type BF machine. The standard IEC 62353. Next, I want to explain the specification for GE VOLUSON S8. First, for power specification, the voltage 100 to 120 volt AC, 220 to 240 volt AC. The frequency 50 to 60 Hz. The power consumption nominal 900 volt ampere including all options. The typical power consumption with 500 volt ampere load approx 1.75 ampere at 230 volt with 50 Hz without peripherals. Second, for dimension, the height for maximum 5725 mm, for minimum 975 mm, for width 620 mm, for depth 850 mm, for weight no peripherals 90 kg, maximum 121 kg. The monitor 19-inch flat screen LCD monitor. For features: 1. Adjustable console height, 2. Rotatable keyboard, 3. Advanced specular reduction imaging, 4. Dual view, for lastly advanced volume contrast imaging.
Advantage and disadvantage of GE VOLUSON Ultrasound Machine. The advantage. One of the most obvious advantage of GE VOLUSON S8 ultrasound machine is its portable. Second, it has volume technology where easy volume, capture, interaction and display are made possible by a comprehensive set of 3D 4D features. Lastly, GE VOLUSON S8 has an advanced VOLUSON technologies where there is a volume capture imaging VCI, OmniView, HD Live technology and HD Flow, tomographic ultrasound imaging TUI, and lastly, Sono VCAD heart, Sono VAC follicle, and Sono VAC entry. The disadvantage. First, it has a heavy weight compared to VOLUSON T8, which is 90 kg. Second, while GE VOLUSON S8 perform better in 4D, it has a little inferior to the image quality compared to Affinity 70. And lastly, while GE VOLUSON S8 is primarily used for OBGYN, 4D 3D, breast and small part of application, it could not scan neonates.
Ultrasound GE VOLUSON S8 have many type of mode like we show in this poster. First is D mode, that stand for brightness and give two-dimension information about the cross-section. Second, motion mode or known as M mode. This represent movement of structure over time and commonly used for measuring chamber dimension. Third is color Doppler mode. The pulse used in color Doppler is longer in duration and has a narrow frequency bandwidth or a high quality factor. MCFM mode is combination of motion mode and color flow mode, CFM. So, what is CFM? CFM is a two-dimension image that portrays moving reflector in color. The different color can represent velocity, direction, amplitude or variance of blood flow. Power Doppler mode. It used to obtain images that are difficult or impossible to obtain using standard color Doppler. Next, imaging with HD flow mode demonstrate moderate blood flow within the mass. Pulse wave Doppler mode, or known as PW, provide the ability to target a specific area in the vessel to measure velocity. Last is CWD, stand for Continuous Wave Doppler Mode, used to accurately measure the higher velocity blood flow typically found in the heart.
Hi, come back with me, Fatin. Now, I want to explain the work procedure. This is the basic procedure for all ultrasounds. Before examination, the steps will depend on the area or organ that is being examined. For abdomen, must fast for 8 to 12 hours before examinations. For gallbladder, liver, pancreas, patient must eat a fat-free meal the night before the test and then fast until the procedure. Other examinations, patient need to drink a lot of water and a whole urine for get clear image. And also important, to patient ask doctor any questions about this procedure. During examinations, patient may need to lie on exam bed or in the position so that suitable for the test area. Then, sonographer put a gel on a transducer and be applied to the area of the body being examined. The transducer is placed to the body and moved back and forth over the target area. The gel will help in the transducer secure contact with the body and the elimination of air pockets between the transducer and the skins, which might prevent sound wave from passing into your body. The gel also helps transmit the sounds waves collects that one that's bounce back and sends them to a computer which creates the image. Ultrasound examination takes between 30 minutes and hour. After examinations, the gel will be wiped and cleansed from skin after the procedure. Ultrasound gel usually does not stain or discolor clothes. Following the procedure, patient will be able to resume their usual activities. That's all.
Okay, clinical application of ultrasound. First is neurology. Neurology are the treatment of all problem and disease related to the central and peripheral nervous system, brain, spine and synaptic connective tissue. Example is stroke and brain tumor. Second is breast. Use a sound wave to produce picture of internal structure of breast. It is used to help diagnose breast lump or other abnormalities found during a physical exam. The third is urology. Urology is ultrasound transducer. Probe is inserted into the rectum to see the prostate. The probe send and receive sound wave through the wall of the rectum and into the prostate gland. Number 4 is abdominal. An abdominal ultrasound is non-ionizing procedure used to assess the organs and structure within the abdomen. And 5 is cardiology. Cardiology is cardiac ultrasound, also known as echocardiography, concerns the ultrasound imaging of a very fast moving complex organ position. End of the clinical application is musculoskeletal, pediatrics, vascular and peripheral vascular, and the last one is obstetrics and gynecology.